Thanks, everyone. Welcome back. We are ready for our keynote speaker. I'm so excited that Dr. Nina Browner was able to join us today on a Saturday. This is one busy movement disorder specialist. Let me just read you a quick little blurb about what she does. She is the Associate Professor of Neurology and the Director of the Parkinson's Foundation Center of Excellence at University of North Carolina in Chapel Hill. She divides her time between patient care, research, mentoring medical students and neurology students as also the neurology residency program director. I had the opportunity to participate in a workshop a couple of years ago with Dr. Browner. And I just walked away so amazed at how she talks to her patients, and she's just down to earth and wants to be real with them. She wants them to be real with her. So we're so excited to have her. Dr. Browner, thank you so much. And I'm going to turn it over to you now.
Thank you so much for such a kind invitation and such an amazing introduction, Anne-Marie, and I am really excited. I think you guys all of you are amazing. It's 9:30. I do hope that you have a nice cup of coffee and some donuts next to you. So that because we're going to dive into very interesting topics. So when we've talked with Anne-Marie, the idea was for us to create an update in research and treatment of Parkinson's disease. And this is some of the topics that, you go to your doctor, to the movement disorder specialist, and you talk about everything. And then at the very end, you really, really, really would like to just kind of like ask this question. So what's new? Tell us what's new. And it's very hard to take that time. And so I'm hoping that with today's presentation, I will be able to tell you what's new, and I will be able to create hope for what's happening overall in the world of Parkinson's disease. So without further ado, let's get on going. So when we're thinking about the challenges currently facing Parkinson's disease community, I think the way I think about them is that they're divisible into different parts. So the first one, the question is that how can we prevent Parkinson's disease from development? That's number one question. Number two question is actually how are we going to slow down the progression of Parkinson's disease when it's already happened to a patient, for example, or a loved one. And the last but not least is that when it's already there and the symptoms are there, how to improve the lives of people with Parkinson's disease. And the idea of today's presentation is for us to try to kind of like get to know the answers to all of these questions. And so we will start with how do you kind of like slow down the progression of Parkinson's disease. And this is something that's called disease modification. So idea of the disease modification, what it means is that we will use different modalities and we will talk about all of them that will eventually can slow down the symptoms or reverse the symptoms of Parkinson's disease. And then we can talk about disease management, which is basically talking about different modalities again that help control the symptoms of Parkinson's disease. And so we'll try to talk right now first about disease modification. So when we're thinking about disease modification, which is basically slowing down Parkinson's disease, preventing Parkinson's disease from happening, when we logically think about it, we usually think about it this way. We think that we need to identify risk factors, also called why. Why would somebody develop Parkinson's disease? What is happening at that time, or what had happened 15, 20 years ago, or maybe even at birth, that suddenly predisposed us to develop Parkinson's disease ultimately many years down the road, right? The next question becomes is it possible for us to protect so-called neurons, which is basically the cells of the brain that produce dopamine? Is it possible for us to protect them so that even though they have been modified by the genetic factors or environmental factors, they really are not slowing down the production of the dopamine, and they basically will not create a lot of the symptoms of Parkinson's disease. So like slowing down basically the progression. And the last but not least, if we don't have enough dopamine producing neurons, can we replace them? Can we literally take some other cells or some other modalities and place them in the area where dopamine neurons should be working and not working right now? And that way we could basically, again, slow down the progression of Parkinson's disease and modify the disease from its original trajectory. Make sense? Okay. So then here's the question. So how do we identify the risk factors, how we protect the neurons, and how do we do replacement of the neurons? So to prevent the development of Parkinson's disease, let's just look into the disease itself. This little guy is a neuron. This is basically the cell that produces dopamine. And it looks really funny this way, but basically it tells the body has a little teeny dendrites, which is basically little teeny areas that kind of connect to the other neurons. And then a very long tail called axon. And the dopamine is produced somewhere over here in the body, and then basically given up at the end of the axons to the other neurons. And when they pick up the dopamine, they basically transform the chemical of the dopamine into so-called action potential or electricity. And suddenly the arm is moving very well, your leg is moving, and you basically have juice to run and do whatever you need to do. That's what dopamine does for us. So we understand with Parkinson's disease that when we look at the people with Parkinson's disease, they usually don't have the same amount of dopamine producing cells. And the cells themselves, those neurons that we're looking at right now, they really don't produce a good amount of dopamine. So something influences them. And we think about what influences them. We divide those factors into environmental factors, which is usually different types of toxins and viruses and oxidative stress. I mean, you may have heard the story about back in the 1980s in California, where the young kids were using makeshift opioid medication that they injected IV, and eventually they created a disease that looked like Parkinson's disease. And so what we know is that when they were creating this makeshift opioid and injecting themselves, they basically created so-called toxin called MPTP. They look like Parkinson's patients. We also know that viruses can create as Spanish flu, for example. Some of the people after the Spanish flu, they had issues with basically creating Parkinson's disease. But right now, would you like me to try it again now? Is it a little bit better?
So this is Dana Marie. It's still a little crackly. I don't know why. It was fine in the beginning. Might just be the connection.
It usually comes with the connection. That's exactly right.
Yeah.
That's exactly right. So do you still feel me that I am very crackly right now?
You're not very crackly right now, no.
Huh, that's interesting.
I know.
I'm not sure.
Could be the clouds. If you don't know if you have clouds where you are, but it's very rainy where we are.
It is a little bit rainy here too.
All
okay,
right.
guys. So where do you want me to go? Do you want me to go all the way back to which part?
I think you're fine. Just continue. Let's start with this slide and go forward, because we do have the recording and we can always send that out. And if people have questions about what they couldn't understand, maybe we can get those answered later.
Okay, sounds very good. Sounds
Okay.
very good. But please, Anne-Marie, if you noticing that my video, my microphone is not working, just interrupt me immediately.
I will.
Jump in and just, yes.
Gotcha.
Okay,
I will do that.
okay, thank you. Alrighty, so let's just talk about this through, guys. So basically, I was talking about that in the middle of the slide, you're seeing something that's called dendrite, which is an cell body and axon. And all of this together is actually the neuron. And this neuron is the one that produces the dopamine. So what we know is that when somebody develops Parkinson's disease, for some reason, this particular neuron is not producing dopamine in a good amount. And also, if you look at it, you will notice that there's not enough dopamine producing cells in the person's brain. So obviously, to prevent the development of Parkinson's disease, we have to try to somehow figure out what causes such a strange development where out of the blue, as they call it, the neurons suddenly decrease in their numbers and also decrease the production of dopamine. So what we were thinking about is that maybe there are some environmental factors that create such a problem. And so one of which was very well known, and I was telling the story that in California, there were young kids who were doing their own home-based opioid drug, basically IV. And some of them, after injection of this strange chemical that they created, developed symptoms of Parkinson's disease. And then eventually there was a huge research where we realized that this medication or this drug that they were creating transformed in the kid's body into the toxin called MPTP. And to this day, sometimes when we have to create animal models to kind of like think about how Parkinson's disease looks, we actually inject MPTP into the model animal and can kind of like modulate or create similar symptoms like people have with Parkinson's disease. We also know that viruses can sometimes create issues. I'm sure all of you have seen the movie Awakening with Robin Williams playing a neurologist. You know, I've always wanted to be a neurologist like this. He was so amazing. He was so thoughtful. He's the patients, there's an amazing connection between him and his patients. So he was always an inspiration. But he was basically playing out the time where a lot of the patients were exposed in the beginning of the last century to Spanish flu, right? And some of them developed encephalitis and it presented with Parkinsonian features. And these are the people who received the levodopa when it was developed eventually. So we know that viruses sometimes can influence the cells in the brain to the point that they're not working anymore. At the same time, recently what we also realized that there's a lot of genetic factors that play a role in development of Parkinson's disease. And right now, this is how many genes we know that are linked to development of familial Parkinson's disease. And even though familial Parkinson's disease is quite rare, it's only about 10% of all the 7 million people who we have in the world with Parkinson's disease diagnosis. It's still very interesting to try to understand genetic predisposition of Parkinson's disease, because when you understand what the gene is doing, you can actually kind of like trace the trajectory of what's happening in the development of Parkinson's disease. And then you can extrapolate whether that happens also to patients who not necessarily have the particular gene, but maybe the same mechanism happens in their body as well. And this is how they develop Parkinson's disease, right? And so overall, we know that the genetic predisposition and our environmental exposure together causes the sporadic cases of Parkinson's disease. And so here's the new idea. The new idea is a newly formed study. It's called PD Gene or PD Generation. And this is the study that basically spearheaded by Parkinson's Foundation along with several centers around the United States, where the idea here is to try to test genetic factors or genes of any patients who were diagnosed with Parkinson's disease, any patients, and also collect the information about the patients and collect the information about their disease and their symptoms, and hope to extrapolate whether there's going to be any connection between this particular development of Parkinson's disease and any of the genes that they can find in the patient. And so here on the side, you see basically all the names of the genes that we know now relatable to development of Parkinson's disease. And the hope is that if we have a humongous database of people, imagine you have to find 10% of all the sporadic Parkinson's disease patients. But if you have the database of these blood samples or other tissue samples for these people, you would be able to create this amazing ability to extrapolate what genes and how these genes are ultimately influencing the development of Parkinson's disease. So I put here on the bottom of the slide the information where you can find a little bit more about PD gene. The study is open to everybody. You don't have to have a family history of Parkinson's disease to participate. You literally just have to have a diagnosis of Parkinson's disease. That's it. That's what they're looking for. And all the information is actually there. I love the video that they created for patients to explain what they're trying to do. I would love for you to maybe check this out, and if you're interested to understand a little bit better what's been happening with that. But to quote the Deputy Director of Research for Cure Parkinson's Trust from UK, basically the genetic risk factors are extremely important to figure out because it will give us the understanding, as I said, biological pathways to how the Parkinson's disease develops and how it progresses. And if we know the pathway, we could potentially use medications or use different substances or different techniques to modify these pathways, which becomes a good segue for us to talk about disease modification. So we talked about identifying the risk factors for Parkinson's disease, and we will talk in a second about the replacement of these neurons, but let's talk about neuroprotection. So talking about neuroprotection, which means that we're trying to understand, can we develop any medications or utilize any medications that are already available on the market that will protect dopamine producing cells? And the study's been ongoing for that for the past, I would say, 25, 30 years. I've summarized here for you different studies for the past 10 years. And then you quickly realize, looking at the table, that the results of all of the studies are pretty much negative. And they're negative because we really don't have a very good understanding of the pathway to what happens in people with Parkinson's disease. And every single time we become very excited, our first studies were with selegiline and now rasagiline, and we figured out that they're not slowing down the progression of Parkinson's disease. And then there was a huge movement from the NIH to create so-called a net PD study, where basically a lot of scientists put their heads together in the beginning of the last decade to figure out which medications or which chemicals available to us right now could potentially influence the progression of Parkinson's disease. These chemicals were all put in a different type of trials and studies. And then you see in here basically the results of these conversations, where we're noticing that a lot of them, such as coenzyme Q10, creatine, when they put in the rigorous trials, they basically don't show to us any slowing down the progression of Parkinson's disease. The very recent development is istradipine, which is the hypertension medication, and the medication that influences uric acid. Both of them also were negative in slowing down the progression. And I know that maybe the slide look a little bit, how you say it, maybe the slide looks really depressing you know, it is possible. But I really think that it basically speaks to the humongous effort of a huge group of scientists who really, really would love to understand how we can slow down the progression of Parkinson's disease. And for me, this slide, even though there's a lot of results that are negative over here, it tells me that there's a lot of people who are thinking about how we can slow down the progression of Parkinson's disease. And they're really creating the connections to the previous statement where it will be very important to figure out what factors influencing this particular cell over here, and then how can we eliminate those factors, or how can we influence those factors, and this whole idea of a disease modification. So we talked about this risk factors, we've talked about neuromodulation, and the last one we want to talk about when we're talking about disease modification is that, can we replace these neurons? Meaning that, okay, well, they're not working very well, and maybe they don't have a very good function, but it's possible for us to just take some other cells and place it into the area of the brain and ask the cells to just produce dopamine for us. And these are basically very interesting approaches with gene therapy, cell transportation, or stem cell transplantation. And the idea here is that it's a quite complex science, and we've been talking about it for a very long time. And I do have a slide for you to show where we are at right now. But before we're going to talk about where we're at, I wanted to show you how many hurdles are there to try to replace dopamine neurons. First of all, which is very important hurdle, is to understand what type of cell would you like to transplant. So there's different ways of getting the transplantation. We've done fetal transplantation, which is basically when you take dopamine producing cells from the homogenate of the fetal cells. So this is basically any fetal cells that we can get from forcible abortion or early termination of the pregnancy for any other reasons. And what they're doing is it basically they create kind of like homogeneous cells out of the particular part of the brain where they would be already sitting in the caudate or putamen. And these cells, the fetal cells, are basically introduced into the brain of another person. And it's been done 40 years ago, and we know that the cells really are alive. We know that they produce dopamine. Some people were able to come off completely Parkinson's medications, but some people had a lot of trouble with too much of production of dopamine because the cells were basically overproducing dopamine. And eventually the results were kind of like very inconsistent. And so that's why the idea was to try to see, is there any other way for us to figure out stem cell transplantation? The other thing also to remember is that it's very interesting. Every single cell that we have, a dopamine producing cell, it's not producing dopamine all the time. For example, I don't have any Italian blood in me, but I love to talk with my hands. So the more I move with my hands, I produce a little bit of a dopamine, but all of you who are sitting looking at the screen most probably don't produce any dopamine at all, or very small amount. The moment you say, Dr. Browner is very boring and it's very hard to listen to her presentation and you want to get up to go to get her another cup of coffee, that's the moment where your dopamine producing neurons suddenly say, whoa, he or she is on the move, let's produce extra dopamine. Now, the funny thing is that the switch between not producing at all and producing dopamine, it's actually happening not just by the cell alone, but by signaling the cells around it. So there's almost like a family of cells that basically live around dopamine producing cell that tells them time to work, or shh, a patient is sleeping, don't produce any more dopamine, we don't need it right now. This makes sense. So just transplanting only dopamine producing cell into somebody's brain was not completely answering the question, because even though it was producing a lot of dopamine, it was not modifying the production of dopamine depending on what the patient was doing during that time. So that's why the question became, could we do some other stem cells? The stem cells maybe that are very neutral, that they do not know that they're supposed to produce dopamine, and we teach them. And we either teach them in a petri dish and then we transplant them, or we kind of like transplant them while they still don't know what they're supposed to produce, but we transplant them with other cells around that will teach them what to do. So it's extremely complicated science. The next thing is that some of the cells produce or reproduce themselves in a very strange or speedy way, and their potential of a cancer development in the brain when somebody has a stem cell transplantation. And that's been known in petri dish, and it's been known in animal models. And so one has to be very, very careful. And that's basically hurdle number 2. Hurdle number 3 is something that I was trying to explain, to what type of cell do we want to transplant. Hurdle number 4 is that, is the cells are going to be taken from the patient's body, or is going to be taken from other humans' body, or they're going to be coming from the embryo? Do you see what I'm saying? So basically the source of the cells, and eventually also to where to transplant them and how many. How many is a good amount? And so you can appreciate right now that every single hurdle that I put in here has all the little teeny tiny hurdles as well. And basically every single one of them require a very extensive research to really understand what needs to be done. But here's the interesting information for you. There is a study that basically transplanted 11 patients, and the study name is Trans-Euro. It's a European Union funded study where they basically making the transplantation of the fetal dopamine cells. It's called allograft, which means basically your own cells are taken from you, the stem cells, and they basically are taught what to do. We don't know results yet. We just know that 11 patients were transplanted, and the completion is not expected until 2021. So that's very, very huge information for us, because, for example, 3 or 4 years ago, I wouldn't have able to tell you much about a really kind of like research study controlled environment where the cell transplantation has been happening for humans. The other thing that you need to know is that there is embryonic stem cell studies that's called European STEM PD and New York STEM PD that basically are trying to organize themselves. They haven't been doing anything studies on the humans just yet, but it's basically working on it as well. And there's a very recently start of the pluripotent stem cells. So the stem cells that really don't really know who they want to be yet. They don't know how to produce dopamine. They don't know how to produce anything, that you have to teach them what to do. And this type of stem cells studied in Kyoto University Hospital. I've overheard that it's already started, but basically was slated to start this year. So as you can imagine, there's very early stages of the clinical development process. So we're talking as like very, very early stages. We're talking about a phase 1 study or phase kind of like early phase 2 study where you basically have a very small amount of human subjects and you're trying to ask the question about literally feasibility, whether the study can be done. You're not even looking at the results just yet. You're just making sure that they're safe and there's something that we could consider expanding to a little bit more number of the patients. But it's extremely exciting, because even 10 years ago, all of this sounded more like a great science fiction. And so right now, having this information that 11 patient has been transplanted, this feels like a very big and huge step forward. And knowing this, I wanted to quote Michael J. Fox, where he says, there's a lot of ways we're approaching the disease. We think we can find the button that can lead to cure. I mean, science is hard. So I hope that from this part of the presentation, you get some feel about how many people trying their best to figure out what to do for people with Parkinson's disease, how many approaches they use, how many different approaches there are to disease modification. And for me, looking at this information, I usually derive hope, knowing that complexity of Parkinson's disease addressed in a very complex way. Does it make sense? So that people don't think that there's going to be only one way to addressing Parkinson's disease, that there's people thinking about different approaches through the genetics, through the medications that would slow down the progression, through the stem cell, different ways. So that's kind of like very, very exciting. And I think that it's been getting more and more exciting for the past, maybe, I would say 10 years. So we talked about disease modification. I think that it's going to be a good time for us right now to move to disease management or symptom control. So what's happening there? Well, these are the two people that most probably everybody heard about. So this is Ole Hornikovich and Arvid Carlson. Arvid Carlson received Nobel Prize in 2000 for understanding that dopamine or low production of dopamine is the problem with Parkinson's disease. And Ole Hornikovich actually is the one who created dopamine and figured out L-DOPA, and then he went to the Corsia studies about dopamine. Here's a dopamine molecule over here. This is how it looks. And to this day, I know it sometimes sounds very frustrating where we say, so is there any new medications, and the doctors keep saying about carbidopa, levodopa, it's still the best. But that's the idea of the Nobel Prize in medicine, is that the discovery of a dopamine deficiency, and then subsequent discovery of the molecule, and then subsequent discovery that you can create this molecule as a medication, carbidopa, levodopa, it continued to be the most important discovery that we have done. Because if you look at the different diseases out there that all sit in the world of neurodegeneration, and I'm going to name some of them for you: Alzheimer's disease, Lou Gehrig's disease, for example. None of these diseases have the medication that improves symptoms as tremendously as carbidopa, levodopa. And so that's why this discovery of dopamine and discovery eventually of the medication has been incredibly important. And I really don't think that it slows down our research in trying to figure out new ways of treatment, but I think that it definitely helps our patients to live an amazing, full, productive lives with Parkinson's disease. So how do we work on improving lives for people with Parkinson's disease? Well, a lot of studies and a lot of medications that has been recently approved or currently in the studies are all working on so-called dopaminergic pathway, which is basically trying to work with well-established molecules such as dopamine itself or so-called dopamine agonists to help out with motor symptoms of Parkinson's disease. And whenever we ask our patient what is the biggest problem for them in regards of the Parkinson's disease, they usually talk about motor symptoms, and they usually talk about non-motor symptoms. I'm going to mention them in a second. But when people talk about motor symptoms, they always say that I would like my medication to work better, or I feel that medication sometimes starts to wear off on me and I have to take medications a little bit sooner, or when I take my medicine, it doesn't really work immediately when I need it, or I would like to have the medicine that I would take just before going to golf or just before going to rock steady boxing so that it will improve my function and I would enjoy myself more with my friends doing what I like to do. And so a lot of the therapeutics that I put here on this slide is really focusing on treating Parkinson's disease off periods, or basically the times where maybe the carbidopa levodopa is not working as well, or we would like to stretch how long it's working, or we want to give it a little bit of a boost. Okay, and so you can see that for the past 2 years, it's been incredibly amazing to watch the increase in FDA approval of different types of medications. And you may have heard several of them. So for example, we now have inhaled version of levodopa called Imbrija. We also have new medication, which is istradefylline, and that's also helpful to decrease patients' off time. Many of you may be taking such medication as called entacapone or Compton, which works on the enzyme COMT that stretches out every single carbidopa levodopa dose. So there's a new medication which works kind of like with the same enzyme COMT, but it's called opicapone, which is supposed to be once daily, twice daily medication, and would stretch out how long the carbidopa levodopa works, which is also will help with this kind of like wearing off and feeling that your medications are going on and off. And then there's also a medication that's called Kinmobi that really was just approved, which is the sublingual, kind of like a thin film that you put under your tongue. And this is apomorphine, which is a dopamine receptor agonist. It's kind of like a very fast acting, kind of like synthetic, almost like a L-Dopa for people who want to really have a very quick beginning to their doses of the carbidopa levodopa. So looking at this slide, it's amazing how many medications came out in the market for the past 2 years, and all of them make a lot of sense for people with Parkinson's disease, because we do want to stretch out how long the carbidopa levodopa works. And we do want, for example, sometimes to have a quick fix or quick boost or oomph, as I say to my patient, of the carbidopa levodopa so that we can continue with our activities. I also mentioned a word that's called non-motor symptoms of Parkinson's disease. And these are basically symptoms that does become with Parkinson's disease, but not necessarily a tremor, slowness of movements, or tightness of the muscles, or balance issues.
Dr. Browner?
Yeah?
Can I just, for a real quick moment, I just want to remind people or let them know that if they want to ask you questions, they can put them in the Q&A box at the bottom of their screen where they've been putting questions about the sound quality.
Yes.
I want to let them know they have the opportunity to do that, that we'll try to answer some questions at the end.
And so Marie, are you going to be my monitor? Are you going to? Awesome. I love it. Thank you so much.
Yes,
Thank
no
you
problem. I will monitor those for you. So folks, feel free to ask questions, put them in the Q&A box down there, and we'll ask Dr. Browner when she's done. So sorry, just wanted to put that in there.
That's perfect. I have only 5 minutes, and then I'm all yours for all the questions.
You're fine.
So this is the non-motor symptoms, and looking through them, you could potentially relate to some of them, I'm sure, especially something like a constipation and fatigue, sleepiness. It definitely is the symptoms that come up in conversations in clinic almost for every single patient. Some people have troubles with connecting with the blood pressure. And I didn't put all of the names of all of the medications because basically these are ongoing trials and we really don't have the results just yet. But I just want to give you the feel with this slide, how much is happening to not only address movements, movement issues of Parkinson's disease, but also try to address non-motor symptoms of Parkinson's disease. So for anybody of you who kind of like thinking about this list and seeing some of the symptoms that has been a bother, there may be medication coming down the pipeline that will make difference in your symptoms. But I always want to give a plug. I think that it's extremely important to discuss your symptoms with your neurologist, your movement disorder specialist, because sometimes the old-fashioned medications that have been around the block for many years can do a tremendous job taking care of your symptoms. So I wouldn't not discuss the symptoms with your providers until this new trials comes through. I think that I would do it now. I would put them on the map. I would try to figure out how we can address them. But I was wishing to show you this slide to give you the hope that actually a lot of people thinking about non-motor symptoms of Parkinson's disease, because we absolutely recognize that there is more than movement disorder when we talk about Parkinson's disease. Now, this is very interesting. You know, we talk about dance, we talk about exercises, but it's been really interesting to see for the past 5 years, more and more research, more and more effort put into really understanding what are these additional therapies give people with Parkinson's disease. And I wanted to highlight this paper here that is meta-analysis of 16 randomized controlled trials for people with dance and whether the dance makes any improvement in motor symptoms of Parkinson's disease. And altogether, collectively, they basically looked into 636 participants. All of them had a mild to moderate Parkinson's disease. And what they really noticed that the dance can improve balance and motor symptom severity. And so it's incredible that we have a study about that. So any of you who want to sign up for tango lessons with physical distancing or immediately jump up right now and dance with your partner, do it, because it is going to be amazing for your balance and for motor symptom control. So we still have to figure out how much the dance improves non-motor symptoms and the quality of patients' lives. And I know many of you smiling, all of you dancers who know that, of course, my quality of life is much improved after I'm dancing. You know how the scientists are. They really need to know it from the good randomized controlled trial. I'm sure that we will have an answer to that soon. But this is a very interesting study that just finished. And we know now that dance would be very beneficial for a lot of people with Parkinson's disease. By the same token, of course, exercise. So this was a very nice review that has been recently done in June 2020 that talked about chasing protection in Parkinson's disease. Does exercise reduce the risk and progression? And you know, we are edging, we are right there on the edge. We like slowly get into this idea that there's a huge possibility that exercise really changes or modifies so that trajectory of Parkinson's disease that we've been talking about. And this paper over here, it's amazing because it goes over multiple different studies that we have in regards to the exercise and points out the improvement people who are exercising with Parkinson's disease, that their trajectory of Parkinson's disease is much better, that people who do not exercise or delay start of the aerobic exercise even for 6 months after diagnosis of Parkinson's disease, really not doing as well as the people who started doing it immediately after the diagnosis or were doing it before the diagnosis. But this is what I want to show you. This is going to be a new study that's going to be coming up. It should be started back in March, but with the COVID-19, I think that they delayed their start. It's called the SPARKS-3. There were several SPARK studies. And what it's trying to do is a multi-site phase 3 randomized controlled trial where they're going to recruit 370 participants and see what they're doing. They're basically trying to create 2 groups with different type of exercise that each of them are going to be doing. So group 1 is going to definitely have a little bit more intense exercises, and group 2 a little bit less. But what's really impressive is that they will be asking them to do these exercises for 18 months. And then they will be checking on them clinically and with neuroimaging trying to see whether they still have the same amount of dopamine producing cells, or they improved any or slowed down the progression of their Parkinson's disease. We're all extremely excited to look at the results of the study eventually when they finish. It's a 24 months study eventually, so we expect results sometime in early 2023. But I think that we are really coming very close to understand what does exercise do for people with Parkinson's disease, and basically putting eventually a very specific spin to how much exercise would be important for somebody who would want to do modification of their Parkinson's disease. And this is the question I usually get from my patients. Is there anything I can do for my Parkinson's disease without taking medication? So basically outside of the medications. And this is usually what I answer, is that we definitely know that physical exercise, which is moderate intensity, about 30 minutes a day, 3 to 4 times per week, is extremely beneficial in modification of the trajectory of a Parkinson's disease. But we really see that there's no influence of diet into Parkinson's disease, and there's been a lot of studies coming up again about that. And I think that in 1 or 2 years, if you invite me back, I can talk about those studies because they're going to come to fruition. We also have actually a lot of study on the vitamin supplements, one of which is vitamin E, that's shown to be not effective. I've shown you some of the studies that basically utilizes creatine, coenzyme Q10 as a supplement, and none of them kind of like showed the benefit in slowing down the progression of Parkinson's disease. And I would say that the other vitamins or substances were not necessarily well studied. And the natural products, which you know, kind of like it's been a lot of different natural products, for example, Mucuna, which is a supplement that contains dopamine, or the same as CBD oil. Unfortunately, right this moment, we do not have very good studies that adequately control and understand what is the benefit for people with Parkinson's disease with this natural product. So at this moment of time, if you're asking me, is there anything I can do for my Parkinson's disease without taking medications? I think the exercise is the only out of this things that I mentioned here is the only thing that we kind of like really have a lot of studies and really shows that it would be beneficial in disease modification. And this is what the last few things I want to show you. This has been an amazing, amazing review that came out, as you see, in August 2020 in Journal of Parkinson's Disease. And what they did is that the researchers basically looked into all the studies that currently happening within the Parkinson's disease, trying to address different ways of Parkinson's disease. And so what we see is that there is 145 active registered trials between January 19 and January 2020. 88 of these trials focus on the symptomatic relief, which is basically the symptom relief that we just talked about. And 57 trials actually focusing on different ways of slowing down, stopping, or reversing the progression of Parkinson's disease. This is a tremendous amount of trials, and we anticipate and we will track the resolution and results of all of these trials in the nearest future. I want to show you this. I know it's a very busy, but you will basically can understand. It's just kind of like to show you how many trials do we have. And so on top is the modifying therapies for disease modification, and this is basically symptomatic therapies for disease symptom improvement. And you can see that there's a phase 1, 2, and 3 trials, which is basically phase 1, where you just go in onto a petri dish or animal studies. Phase 2, when you have a very small amount of patients looking into feasibility of the study. In phase 3 are the trials that that look into actually effectiveness of the medication or anything that they're using for the trial. And you can see that it's evenly spread. I want to show you the next slide. So for right now, for January 2020, if you look at the clinicaltrials.gov, which is basically the place where you could find all the clinical trials registered for patients with Parkinson's disease, this is a distribution. You can see that basically here's altogether 145 trials. And in phase 1, this is the usual distribution. In animal trials in the Petri dish, you have kind of like almost even distribution between disease modifying and kind of like symptomatic control. And then in the phase 2, when we look at the feasibility, it's still kind of like similar distribution. And this we know that in phase 3, disease modification trials a very small amount because it's very hard. This is the divide basically. So it's very hard to jump from feasibility to really showing the benefit in humans. And you can see that there's a lot of symptomatic trials. I think most of them I mentioned in my slide, and there's only 3 right now that look in the disease modification, but a lot of them so-called in the pipeline. So if anything, looking at this slide, I just wanted all of you to appreciate how many people are working on the disease modification and on symptom control for people with Parkinson's disease. Every single chart that we see here, 145, when it says it's actually multiple centers. We're talking about a lot of patients involved. And if anything, I want to conclude here that it's very encouraging to see this wide range of approaches, not only for symptom management, but also for the disease modification. And I think that you could appreciate that the process of bridging between this disease modifying therapy into the clinical use is very challenging but we have hope. And if we wouldn't have hope, I think that we would not be doing what we're doing right now. And so we do have a huge hope that 1 or 2 of these disease-modifying therapies will eventually become available for people with Parkinson's disease and will change the trajectory of their disease. And we definitely seen a lot of improvement with new symptomatic therapy for people with Parkinson's disease. Every new medication that comes out on the market, even if you say that it's still part of the dopamine system, it still gives us tremendous improvement in symptom control for people, which is eventually means better lives. I will stop here. I see there's a lot of activity in the questions, and so I am really happy to hear your comments, your questions, anything that comes to your mind.
Okay, let's see what we have. So I know that you talked about that there's no real, can you hear me? Can everyone hear me?
I can hear
okay. So that there's no, real research on natural supplements or natural treatment, yes. But someone did ask if you know whether there have been any trials pertaining to the effect of using CBD oil.
Oh, yes.
To alleviate any PD symptoms.
Yeah, yes. What I'm saying is that what I'm trying to say that there's no results, but there are actually trials ongoing right now. And I've been asked to recently review a paper that is published results of one of the CBD trials. And the issue with CBD right now is that, as you can imagine, in United States, only particular states can actually make that trial happen. And so the Parkinson's Disease Foundation Center of Excellence in Colorado, for example, are actually looking into use of the CBD, different products that would contain CBD, and what type of improvements people would get from using any of these natural products. And so, yes, there's a lot of studies that are coming through, but we just don't have a good results yet, published results.
Okay, that sounds good. And if we want to be on the lookout for any published results, where do you think the best place for people to check in might be? The Parkinson's Foundation?
I think that the Parkinson's Foundation has been amazing in putting out the, not just only news about what's happening, do you see what I'm saying, but also trying to extrapolate to like, what does it mean for the community?
Right.
I think that Michael J. Fox Foundation also does a very good job, but I feel that they also kind of like talk more about research, and sometimes their language is a little bit harder to understand. But I think that the Parkinson's Foundation is just kind of like, it really does a very good job explaining what does it mean. Okay, so this is a new medication, that's great, but what does it mean for us? Like, where do we use it? So I think that that's where I would look for.
Good. And of course, when we see things, we'll make sure to share them in our e-newsletter.
Absolutely.
From the Parkinson's Foundation.
Absolutely.
Somebody asked, what's the best avenue for finding a relevant clinical trial?
So you saw it, it is the clinicaltrial.gov, which is basically the NIH-sponsored website. The story right now is that by the convention, if you want to do any clinical trial in Parkinson's disease or any other diseases, you have to register it with clinicaltrials.gov. And so what would you do is that you basically go on the website, and on the website you can put in Parkinson's disease, and you can actually put some symptoms, and then it's going to show you all the trials that are there, and you're able to see who are recruiting, where they are, what's the contact information. Some of them are with email, some of them with phone numbers, and you can just browse through and to see what's available.
Perfect. And we have a few more questions, but what we're going to do is take one more, and then if it's okay, Dr. Browner, we'll email you those other questions, and if you can get back to us, we'll post those answers for folks. Okay. So this last one is somebody was diagnosed at 42, early onset. They're now 51, and they're dealing with extreme fatigue with their PD. And any thoughts on what that person can do to help with that extreme fatigue?
So the fatigue is a very big problem with Parkinson's disease, and it's just kind of like this, I feel like it's a ninja, you know, it comes in and you just cannot throw it off. I think one of the ways people to think about the fatigue is that they think about factors that may cause the fatigue, which is basically, is it the sleep issues? Is it a little bit trouble with the weight? Is it a constipation? What else is giving us the fatigue? But also medications such as modafinil, which is basically kind of like activating medications during the day, has been very beneficial for some of the patients to fight off the fatigue. Exercises and doing like particular activities sometimes also beneficial for the treatment of fatigue. So, you know, I would encourage this person to reach out to Parkinson's Foundation helpline. And you can find that information is 1-800 number. You can find this information on the Parkinson's Foundation website. Just say Parkinson's Foundation helpline, because they have resources for people who are dealing with the fatigue and Parkinson's disease. And I think that I would start from there.
That sounds great. Thank you so much. And for the other folks, we will definitely get your questions to Dr. Browner separately and follow up with those and send those out to everyone in case anybody else wanted those answers. Dr. Browner, I can't thank you enough for being here today again.
Absolutely.
You're always a joy to listen to, and I think you give such great information. So thank you.
I'm happy you liked it. I'm sorry if it was too much, but I also was feeling like we should really show people how many things are happening, how awesome things are. You see what I'm saying? Because sometimes people like, oh, well, nothing is new really going on, where you have this humongous community of scientists and also patient advocacy groups such as Parkinson's, Foundation of Carolinas, like PD Avengers, Parkinson's Foundation, you have so many of them who advocate for people with Parkinson's disease. And my last plug for everybody is this: consider participating in the trial. Consider, because all of this advancement, what we don't talk about who behind is people with Parkinson's disease, just like you, care partners, who basically given their time to really understand what is going on so we can move forward. So that's my last.
That was a good plug. All right. Thank you so much.
Have a great rest of
your week.
Bye.
Bye-bye. Thank you.
Bye.
All right, folks, so we are just going to take a quick transition break to just allow some logistics things and allow people to grab a bathroom break if they need to. And when we come back, we are going to have Chantal come up and talk about nutrition and Parkinson's. And we will see you back here in about 3 minutes. How about that? So 10:38. See you soon.